Production begins in 5, 4, 3, 2, 1.
Good morning, viewers of PAC 14. I'm Renee Fredericksen. I work at MAC Incorporated with the Caregiver Resource Center. And as you know from watching previous segments, each time I'm on, I introduce you to another wonderful resource in the community. One of the best resources I can think of is the one that we find at MAC with our specialist in health information. Her name is Carol Humphreys. Carol, welcome to the show today.
Thanks for inviting me.
Carol, we offer so many different things at MAC, and health insurance counseling is really one of the favorite programs that I have there. I'm used to seeing people lined up in the waiting area there to get their appointment with Carol Humphreys. They come because they have questions on insurance and they know that you have most of the answers, and if you don't have an answer, you get right on the phone or on the computer and look it up. I have a couple of questions that have come up now. First of all, SHIP. I know what a SHIP is, but I don't know what the SHIP program is. Can you tell me a little bit about that?
SHIP stands for State Health Insurance Program.
Mm-hmm.
This program has been in effect for years. What we do is we help people with Medicare to get through all of the maze. A lot of people think Medicare is free, but when I started this job, I realized Medicare was not free.
Well, how does that work, Carol? How does a person become eligible for Medicare?
If someone has worked and paid in 40 quarters to Social Security, then usually they're eligible for Medicare.
Mm-hmm.
Some people are eligible for Medicare when they reach their 65th birthday.
Uh-huh.
Then some can be eligible when they become disabled and eligible for Social Security disability. Or if they start kidney dialysis, they can be eligible for Medicare. And there's several other reasons they can be eligible for Medicare.
Now, long ago, about 1935, when the Social Security Act was passed, was Medicare a part of that original Social Security Act, or did that come sometime later?
That come much later. President Lyndon Johnson signed the bill into law that took effect July the 1st, 1965, and Lady Bird Johnson was the first one signed up for Medicare.
Is that amazing? That means that was a part of all those Great Society programs then.
Oh, most definitely.
And for so many of them that have kind of gone by the wayside, boy, this one must be a classic for enduring the test of time, and we still have Medicare with us today. And as you said, it sounds like over time Medicare has expanded to include and cover different conditions that we have. Example, in the Medicare comes in different parts, doesn't it?
Most definitely. When Medicare went into effect July of 1965, it was basically a catastrophic insurance.
I see.
And over the years, they have added preventive care. And then the Moderation Act was signed into law December the 8th, 2003, which added the prescription drug coverage that took effect January the 1st, 2006.
Uh-huh.
So Medicare has really come a long way.
Boy, it's beginning to cover many of the needs that all of us find in common. So there's a Medicare Part A, and that covers
The Medicare Part A covers the
hospitals.
Medicare Part B covers the medical, all outpatient.
Okay.
And then we have a Medicare Part C, that's the choice. Some people have retirement group plans. Some just do the individual Medigap, and some do the Advantage plan.
And then how about Medicare Part D?
Medicare Part D is the prescription drug coverage that went into effect January the 1st, 2006.
Okay. Any other letters I'm forgetting?
Not yet.
Not yet. Stay tuned, right?
Definitely.
Well, speaking of Medicare, You said something about people being eligible at age 65. Now, does that mean that when I turn 65, they'll send me a birthday card with my Medicare card attached to it? And I'm all set to go, or how does that work?
Yes, you will receive it 3 months before you turn 65, only if you're drawing Social Security.
I see.
A lot of us are waiting until we're eligible for full Social Security benefits. If we decide to wait and you still have insurance through your current employer or your spouse's current employer, then you can prolong Medicare and enroll during a special enrollment period.
What is that period in the year?
Well, the special enrollment period is they can enroll anytime once while you're still employed or under your spouse's employer's insurance,
Okay.
or immediately after.
Okay.
But if you're turning 65, do not have insurance through your current employer or your spouse's current employer, and you want to prolong receiving your Social Security benefits, then you need to contact Social Security office and enroll in Medicare Part A and Part B only.
Okay.
And then you can pay your quarterly payments for the Medicare Part B, pay it directly to Medicare.
Okay, well that tells me a lot. You know, I had sort of assumed, Carol, that I would get that birthday card with the Medicare card in it. But I understand now that if I'm already receiving Social Security, I will. But if I don't, I better get myself over to the Social Security office. What if I don't have wheels and I can't get to the Social Security office? Could I sign up online or by telephone?
Most definitely, we can go to www.socialsecurity.gov. We can enroll for Medicare A only or Medicare A and B, or you can call the Social Security office, or you could even call MAC.
And when they call MAC, do I ask for you?
Yes.
Carol Humphrey?
Yes.
Okay,
I've
that
done it
sounds
many a
great.
time.
Carol, what are your regular working hours so I know when I might be able to set up an appointment?
I work for all 4 counties, Worcester, Wycomico, Somerset, and Dorchester. Lots of times I'm not in the office, but if you call, and then I can schedule an appointment for you.
Okay, and of course you have voicemail so they can leave a
Most
message,
definitely.
and be sure to leave their return phone number so you can get back to them.
Anyone feel free to call. Usually I do not leave at the end of the day until I have returned all of my calls.
Okay, and I know from personal witness, Carol, that sometimes those days are pretty long. But if I were to call somewhere between, say 9 and 4 or 5, I would be able to, well, actually I could leave a message any time of the day and you'd pick it up sometime between 9 and 5 and then get back to me?
Yes, and call before I leave at the end of the day.
Okay.
I have lots of people that will leave messages late at night and even weekends. And also, usually before I leave, the first following day that I work, I return the calls.
And I'm a witness to that. You're one of the best, Carol. What other programs does SHIP work with, or is it only Medicare?
Besides the SHIP program, we do the QMB SLMB program, and that is for people that have low income or are less fortunate. And also we do MIPPA. MIPPA is the Medicare Improvement for Patients and Providers Act.
Can you give me just a general idea of what that's about? I'm getting pretty saturated with all the information you've given me today, Carol.
Most definitely. The MIPPA program allows us to do outreach to see if there are certain people with Medicare out here that are less fortunate. Possibly they could have lost a spouse and that changes their income.
I see.
And once the income has changed, you might be eligible for some federal programs that you have earned.
But I'm really not aware of it until I come in for a little counseling session with you or someone else and find out,
Lots
well,
of
what am I
times
eligible?
when you call, I can ask a lot of questions right over the phone. And I have even filled the applications out over the phone and sent it to them to mail. Sometimes
see.
it's not always easy to go ahead and come in. So we work with each individual because one size doesn't fit all.
You mentioned QMB, that's QMB, and SLIMB, SLMB, as part of the MIPPA program. Can you help me understand what QMB and SLIMB are?
And QMB and SLIMB are federal programs that will help low income pay their Medicare Part B premium and also get their prescription drugs at a reduced cost, plus pay the 20% of coinsurance and deductibles from the Medicare Part A and B. The SLIMB will cover the same, except your income would be a little bit higher, so it would not cover the 20% of your coinsurance and deductibles of Medicare A and B.
Okay. Are these programs strictly income-based, or do they count my assets also, things that I own?
The guidelines are income-based and assets.
Okay, so they will take a look at both. If I own a car, if I own a boat, if I own my home, in addition to what income I get on a regular basis.
And most definitely, the first vehicle is not counted if you have a valid driver's license.
Okay.
But if you do not have a valid driver's license, whatever form of transportation you use will be counted as an asset.
I see.
We had a gentleman in Worcester County that had a tractor he used to do his shopping, but that was counted as an asset. But his income was within the guidelines. Had he had a valid driver's license, the tractor would not have been counted as an asset, so that put him ineligible for the program, which was very sad. But it is very strict guidelines.
Yeah. Gives me pause to think about when I should ask Mom and Dad to give up that driver's license. I guess it'd be safer to agree that they not use the driver's license to drive that vehicle, but that they retain it for the sake of eligibility for programs. Yeah. So you work with a variety of insurance programs and a variety of ways that people can access those insurance programs. It sounds like a great job, Carol, helping people to realize what they've earned and how they might be eligible for it and how they might access it and get the health care that they need and get some sleep at night because they're not worrying about it any longer. You must have a great job.
I enjoy what I do. We like to give people peace of mind. We don't want them stressing. Call, we will help. And
who should they call, Carol? What numbers should they use?
Call 410-742-0505, extension 106. Lots of times, if you can't remember that, if you call the Social Security office and ask them a question about insurance, they will give you my number. Every September, we get one of these books in the mail if we're enrolled in Medicare. It depends on what region you live in, but on the back cover, it's the 800 number for the Maryland Health Insurance Program. It's an 800 number. If you call that 800 number, they will give you a name and a phone number for the county you live in.
Cool.
Also, if you live in another state, they can also give you an 800 number for the other state.
Well, that's very helpful to know, Carol, because I'm just still getting used to the idea that our states are smaller than out west, and we may live in Salisbury, but we very well could have family members in Delaware or Virginia or across the bridge in Washington, D.C. that are asking some questions, and we can help them to get connected with you or the Social Security office. I'm wondering if there's anything else that our people should know.
Everyone receives this book in September. And the reason these books are sent out in September is because open enrollment for Medicare beneficiaries is October the 15th through December the 7th of every year.
I'm going to want to note that in my calendar, October
the 15th through December the 7th. And that's a chance for us to change our prescription drug plan. The plans change every year, so the medication you take may not be on the formulary for the same plan next year. Your medications might have changed. Also, we can change our Advantage plan during the open enrollment period. We can change from an Advantage to an Advantage, or an Advantage to a Medigap, or a Medigap to an Advantage. We cannot change a Medigap to a Medigap.
Carol, I just had one other quick question come into my mind, and that is, if I am eligible for Medicare or for Medicaid, and they aren't the same things, are they?
No. Medicaid is available regardless of age.
Okay.
But once you're eligible for Medicare, Medicare would be primary. And that's where the MIPPA program comes in.
I see.
Possibly there might be some level of assistance that would be secondary to Medicare being your primary.
Wow, that's something that I will have to remember as well when I'm enrolling and when I'm investigating all of these things. Carol, is it possible to get a copy of that book from your office or from some other office?
The Social Security office usually has them.
I see.
But there's one per household mailed for anyone enrolled in Medicare.
Anyone
that comes out
enrolled.
in September.
Okay, okay. Well, Carol, I thank you very much this morning for helping me get a grippa on HIPAA and MIPPA and SLIMB, QUIMB, all of the other things that we talked about this morning. It is a complicated issue, but it doesn't have to be, and my first step as I approach age 65 will be to call Carol Humphreys to find out what I'm eligible for and how I become enrolled.
I'll be more than glad to take your phone calls.
Great. PAC 14 viewers, I thank you this morning and for your listening, and I also wish to thank PAC 14 for bringing this program and this information to you. Thank you as well, Carol.
Thank you.
Would you like to see your community organization or nonprofit group featured on PAC 14? To get started, contact us at 410-677-5014 or visit our website at www.pac14.org. PAC 14 is a great way to connect with your community.